report, we are sounding the alarm over the increase in the diagnosis of attention deficit hyperactivity disorder, along with the concomitant rise in the use of prescription stimulants. It could be the next epidemic. My name is Yara Mustafa. I'm an attending psychiatrist at St. Elizabeth's Hospital Department of Behavioral Health in Washington, D.C. I have the pleasure to present with my co-author, Dr. Shohan, the brief report that is expected to be published in the next issue of Mayo Clinic Proceedings in July. The title of our brief report is Attention Deficit Hyperactivity Disorder, Overdiagnosis and Overprescriptions, Medicalization of Distractions.
And I am Dr. Mohit Chauhan. I am a consultant psychiatrist at Mayo Clinic in Florida, and I'm the co-author of this brief report. As Dr. Mustafa pointed out, we tried to look in parallel at two data sets to see if we can see a pattern where both the prescription use of stimulants is increasing as well as the misuse is increasing, and then draw conclusions from it that can alert clinical practices about the potential for both overdiagnosis and overuse of prescription medications, prescription stimulant medications, as well as the potential for these being diverted for misuse.
Another concern is that the people who were misusing prescription stimulants received the drug from a friend or relative who received it from a healthcare provider. So we know that there is diversion. In clinical practice, it's very important that we educate our patients and families about attention deficit hyperactivity disorder and how we make this diagnosis and what are the medications that we prescribe, along with the side effects that are expected.
One of the databases where we looked for patterns of misuse is the National Drug Survey, or it's called National Survey on Drug Use and Health, indicated an increasing misuse of prescription stimulant medications, which seems to have stabilized for the year of 2017-2018. However, overall long-term trend indicates that there is increasing use. The other database that we looked at is called ARCOS database. It is a short form for Automated Reports and Consolidated Ordering System. It's a data collection system that DEA uses, where manufacturers and distributors report their controlled substances transactions to the Drug Enforcement Administration. So this is essentially more an indicator of prescriptions that are being written, not necessarily misuse of prescription medications. So if you will look at a figure in our brief report at Mayo Clinic Proceedings, you will find that there is a dramatic increase, a doubling of the amphetamine prescription use that has been reported. And I say loosely prescription because this is coming from retail pharmacies. It is safe to assume that medication that retail pharmacies are reporting as being dispensed is being written as a prescription. There is doubling of amphetamine, but not really of another medication, methylphenidate, over time, especially over the past 10 years. There is clearly a doubling of the amount of psychostimulants being used or being provided by the pharmacists from retail pharmacies. So there is some evidence that amphetamine has a higher abuse potential when compared to methylphenidate. And that is another reason why we decided to put together this report to raise concerns that there is a possibility in parallel of misuse of amphetamines as the number of prescriptions that are being written is rising.
We have to work closely with our colleagues and our patients and their families in order to reach the correct diagnosis and rule out other mental health issues that have overlapping symptoms with attention deficit hyperactivity disorder. We would like to avoid overinflation of diagnosis by failure to recognize these other mental health issues?
To summarize, we have to look at the trends as we have found and reported in our Mayo Clinic Proceedings report about doubling of amphetamine prescriptions over time. With regards to, is this really because we are getting better at identifying ADHD, or are we overdiagnosing and misdiagnosing ADHD both in children and in adults? We also have to ask a careful question if the demands being placed on the adult or the child, cognitive demands from a performance perspective, are much more than that person is able to cope with at that point of time. And that doesn't necessarily mean that the individual has ADHD. So the suggestion that I would have for our patients or any parent or adult considering the possibility of ADHD is that not all difficulties with attention translate into ADHD. ADHD is a much bigger syndrome. Multiple symptoms have to be present. They have to be present in multiple areas of functioning, and they have to cause either distress or dysfunction. I will also continue and add to the what is the next step for research. This is a very brief report. It takes a look at 2 national data sets. It has found that there is a parallel between increased prescriptions for amphetamines and increased misuse for amphetamines. But it doesn't really, we have theorized about possible reasons why this might be happening, but it really does not provide us any clear understanding if the possible reasons that we have considered in the discussion of this brief report in Mayo Clinic Proceedings is actually correct. And so those are wide areas of research that require a lot of ongoing work.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.